the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. We've already experienced some serious heat temperatures this year, not to mention the high humidity. What does this mean for your heart, though? Joining us this morning to explain, Baptist Health cardiologist Dr. Anthony Fletcher. Dr. Fletcher, thanks for joining us this morning. We appreciate you stopping by. And in these high heat conditions that we've been experiencing, I'm sure a lot of people have felt like they've had a strain in their chest at times just because of just how hot it is. But what are some of the real adverse effects, some serious things that could be caused when it comes to heat and the heart?
Well, the heart, it certainly is an organ that adapts for the changing environment that it's in. And one of the things that happens with the heart is that the skin has more blood flow to it to help cool the body down. And we do that by radiation, where the temperature goes from the warm surface of the body to the cooler environment that it's in, and evaporation. And evaporation is basically related to humidity. And so the heart has to increase the output to supply more blood to the skin, which puts a greater demand on the heart. So obviously if you have a compromised cardiovascular system with a setting of heart failure or poor blood circulation because of narrowed arteries, you might experience more angina or even precipitate the development of heart failure.
Okay.
Or if you've been compensated with heart failure, you may have a decompensation. So the heart plays a key role in that, and it's very important that we recognize that as we work through these temperatures.
You mentioned a couple of things that might cause someone to be at a high risk for that, having a previous heart condition. But what are some of the other risk factors out there for folks that they need to be aware of before they step out into the heat?
Well, certainly if you have just general poor health and overall, the body has to compensate. And so if you have even chronic lung disease, this can exacerbate your lung problems. If you have hypertension and you're taking medications, those medications may make you more sensitive to heart. Things such as calcium channel blockers, ACE inhibitors, beta blockers, and especially your diuretics, which will help also kind of deplete your salt and potassium levels. And so that's important that you kind of keep that in mind with your underlying conditions.
All right, what about symptoms? What do people need to be aware of?
Certainly. We want to be aware of just suddenly having headaches. Your skin becomes cool and moist, dizziness, lightheadedness, nausea and vomiting, dark urine. These are signs of heat exhaustion. And certainly those are things that we want to kind of pay attention to.
What about treatments?
Treatments. Certainly you want to kind of stop what you're doing if you're out in the heat. And certainly you want to go inside and get cooler. You want to put cold compresses or take a cold shower, get in front of a fan. Certainly air conditioning will certainly be helpful. You want to do preventive things. Make sure that you're well hydrated. If you're going to be outside, start hydrating before you go outside, and then hydrate while you're out there and hydrate when you come in. The other thing that you want to do is wear loose clothing. You want to wear light clothing. You want to wear colors that are light colors, not dark colors, because they reflect the heat more. Okay. You want to use sunscreen if you're going to be out in the sun. You want to wear a hat. You want to wear sunglasses. So those are just some of the things that we can do in preparation. And then if you're going to be out doing certain things that are going to be strenuous, have a buddy around so they can pay attention to you and, notice if you're suddenly becoming in trouble with the heat.
And if you can't have a buddy, at least tell someone that you're going to be out there so that they know after a while if you haven't come in, start looking, right? Yes.
And the key thing is to avoid going out during the peak of the heat. So from noon to about 3 o'clock, if you don't need to be outside doing things on a prolonged basis, you want to kind of delay or going outside, or you want to go out earlier in the morning.
I know a lot of people right now are happy to hear you say that. I can't go out right now, honey. The doctor told me this morning on Daybreak it's not a good idea to go out and mow at this time. We appreciate you stopping by as always, Dr. Fletcher. All right, there's the information for the Baptist Health Helpline on your screen right now.